sunscreen is like so important for good skin health?
I would say choose a sunscreen with the moisturizer. You'll be good for a very long time.
It blocks vitamin D absorption. Is that really true?
So get that little shot of vitamin D before 7 o'clock, I would say.
So the shop is the whole thing. Welcome everyone. This is Sunscreen Must podcast. On this episode, we'll be talking more about how to protect your skin, and also we'll be discussing more about sunscreen, because we'll be celebrating National Sunscreen Day, which falls on May 27th this year. Sunscreen is an absolute essential no matter what time of the year it is. With summer season going on, global warming happening, heat waves are so common. So it is time we refamiliarize ourselves with sunscreen practices. To educate us more about, we have renowned dermatologist and cosmetologist. Let us welcome Dr. Purnima from the city we call Singara, Chennai. Welcome, Dr. Purnima.
Thank you.
Yeah, how are you?
I'm good, thank you.
Yeah. So let's talk. But before talking, I should ask you too many questions. What made you a doctor? Because you're looking so beautiful. You could have chosen any other profession, but why to become a doctor? And also, why a specialization in dermatology?
Thank you. I'm flattered actually. So why doctor? Like I was talking before, I'm from the 90s generation. So usually it's about making parents happy. It's about, getting into a professional college, getting into MBBS was the most, proud moment and the pride of parents. So that's how it started. And then slowly, once I got into my UG, doing my MBBS, I realized actually the highest quality of life is from having a good health. So then happiness, peace of mind, everything falls. So every day when you're trying or striving towards that health, I think that made it a complete happiness. And then dermatology, it was not aesthetics like we all think. First, it was only pure dermatology, where we talk about psoriasis, skin conditions, a lot of infections, much more than aesthetics. So there, I realized everything that was happening inside was a reflection on your skin. An instant gratification of the, patients, like you're performing on the stage and immediately you get a applause that makes you happy. It's like that. So when you treat a skin, it gets better in 7 days or whatever the course of infection is. All that when patient sees it visibly, it was like one instant gratification. So that's when dermatology was a choice of my, a specialization.
Wow, beautifully said. So coming into our topic. So, why sunscreen is so important for good skin health?
See, right now, you were talking about, sunscreen awareness has been, at the prime right now. Before 5 years, not all the patients, only about 30% of the patients were applying sunscreen. Now, 100% more, the old generation, maybe they skip out on sunscreen. But 90% of the patients are very, very comfortable with sunscreen, thanks to influencers, thanks to awareness, thanks to a lot of, talk about sunscreen. When you ask me why is it important, see, if patient wants just one product in their skincare, kitty, I would say choose a sunscreen with the moisturizer. You'll be good for a very long time. Because it is not about tanning, it's not about whitening, it's not about, just maintaining your color or tone. It's a deeper thing. The UV radiations, there are different spectrum of UV radiation. So one penetrates deeper, one penetrates to a, upper level where there are acute causes like you tan, you burn. The much more deeper one, it's more towards skin cancers and, damage of your collagen. So there's a varied spectrum of diseases. So to get a healthy, not just glowing skin, you need your sunscreen.
Yeah. As you said, skin cancer. People are really afraid of skin cancer.
Yeah.
Not using sunscreen might cause them skin cancer due to the exposure of sun rays and UV rays. There are many articles out there about. So how do you say?
Skin cancer on the whole is a little lesser in our population, especially the South Indian population. It's a little lesser compared to the white population. But the fear of cancer, because anything and everything leads to cancer. That's because they Google, they talk about, and we are seeing the cancer patients raise in number of cancer patients. So people are really scared. You get one small pigmentation or you get a mole, patient comes running asking if this is cancer. So there is that scare, a lot of myth around this also. But when we see if sunscreen can help skin cancer, yes, definitely. Because the radiations and the spectrum of, rays that we were talking, UVA, UVB, visible light, all this goes a little deeper. It causes DNA damage. So when there is a DNA damage, not just one sunburn or one sun exposure is going to cause cancer. This cumulative effect, over and over exposure, when you're not having a good sun protection, all this will cause your DNA to mutate. So DNA is something that tells you, behave this way, go this way. It teaches that discipline and it teaches that in your skin. So when that is, completely damaged and it's acting in its own way, it causes a lot of reactive oxidative stress in that. So that can be prevented, and the skin cancer can be prevented with just simple application of your sunscreen.
So actually, how can we measure the effectiveness of a sunscreen? Like, how do we know is it working or not? We don't know.
And see, rather than concentrating about working or not, how we choose a sunscreen is very, very important. So that's something that will tell us if this sunscreen is going to protect you and prevent your oxidative stress or the damage, skin damage. So how do you choose your sunscreen? Basic, at our environment and our setup, that our ethnicity, we require certain criteria in our sunscreen. It has to be at least SPF 50. So when I say 50, can we go a little lesser? Some people, we stay indoors. We have desk jobs. Other people, we have field work and field jobs. We travel, marketing, all that. So according to your profession, according to how your lifestyle is, choose your sunscreen. But minimum at least 30 SPF is the requirement. So 30 to 50 is a good grade to start with. And then the next important thing is it better be a broad spectrum, UVA, UVB, visible light. So it covers all the spectrum of your sun. And then, see, we all don't like this white cast.
Yeah.
So one day you apply sunscreen, next day you come running telling it makes me look like a monster. I'm not going to apply. I get a little pigmented. So it has to be elegant. And then it doesn't have, there's something called the comedogenic effect. What is comedogenic? It just occludes, causing acne. During the summer, most of us, we have these pores that are enlarged. We sweat a lot. All the sebaceous glands are very, very active during summer. So this sunscreen should not be an effect where it's going to cause occlusiveness and we start sweating. So that shouldn't be there, and we don't need that acne to be dealt with. So non-comedogenic. And the next is it has to be sweat resistant. The minute you apply, you're going to sweat a lot. And if it's just going to be washed away, the effectiveness of sunscreen is compromised. So we don't need this. So these are basic, criteria that we have to see in a sunscreen. So naturally, there will be an effectiveness. Apart from this, if you're going to ask me, okay, I'm going to use the sunscreen, I'm going to step out, madam, I'm going to come back in the evening, will I be protected? Of course not. You need reapplication. If you're going to be in a desk job, if you're going to have a indoor kind of a setting, then it's okay. We can just get away with a single application. But if you're going to be exposed to a lot of light, yellow light, screen light, if you're close to the balcony, even at home, if you're going to go dry your clothes, if you're going to the bank, women these days, we have these kind of chores also. So all the time, please reapply your sunscreen. Apart from this, have like a physical protection. Carry an umbrella, caps, shades, make it fashionable, your wide brim hats. So all that will also help in the long run.
Yeah, talking in detail, what does SPF actually mean? And also there are too many different types, as you mentioned, UVB, UVA. Like many people don't know what's exactly that. Can you please elaborate on that?
See, SPF is the sun protection factor. So this sun protection factor, let's not get too much into the detail and get it confused. People think SPF 100 means the whole day we are protected. SPF 50, half a day, probably like that. No, it doesn't really work that way. SPF 15 actually gives you 93% of protection. SPF 50 can give you 97. So that 4%, 3% is the difference. So in this, can I just get away with the SPF 15? It's not that way. Because that little percentage also could cause a huge damage. If you're going to stay indoors, then SPF 30 is okay. So that few percentage of coverage is not there, then it is okay. So this is how you measure. So when the sun protection factor is to a point it doesn't cause burning. So that's how we measure the sun protection factor. So this is one thing. When I talk about UVA, UVB, these are different spectrums of light.
Yeah.
The depth that it can penetrate, the wavelength that it can touch the skin. So depending on that wavelength, see if it's going to cause only the surface, if it's going to be touched only the surface, it will cause tanning, burning, blisters, all that. If it's going to go deeper, day by day, when you're going to get deeper, exposure to UVA, it's going to cause your DNA damage, and then your cancer and aging, the wrinkling effect, all that was caused by UVA.
Okay. There are so many formulations available in the market,
Yes.
say cream type or gel type, mist type. There are so many things. How can a person choose for them like correctly?
That completely depends on your skin type also. So skin type is just not oily, it's not about acne causing or dry skin. We'll keep it like this. So during summers, we need 2 sunscreens actually. So during summers, it is better we have a gel-based or a cream, water-based, lotion-based sunscreens, so that it is going to be a little elegant. And during the winters, we'll have a cream-based so that it hydrates you and it also doesn't cause any dryness and chipping, all that. So that is about the cream and gel-based. So when we talk about who can choose what, when you're a working professional, you're going out, you need, you can't wear makeup, you can't wear foundation, you can't wear sunscreen, you can't layer too many products. So these days we're getting beautiful formulations that are tinted. So in tinted, what happens is we have titanium dioxide. That is also a protection. I mean, that is also one of the filters. So that is micronized in the powder form and it is added to your sunscreen. So it acts like a foundation itself. It's so elegant that it is like you're made up, you're fresh through the day, and it causes additional protection. You can also dab it with a talcum powder, which is also an additional sun protection. So this way, and if you're close to the hills, if you're close to the sea, so depending on your location and your geography also, it is very important to choose your sunscreen appropriately. So when you don't have a regular reapplication, when you don't have, and you're on the beach, say you use SPF 30 at home and you're at the beach vacation and you're not going to reapply and still you're going to be burnt.
Yep.
So same sunscreen can be appropriate in one place and inappropriate in another place. So we better be the judge and choose a good sunscreen according to our lifestyle.
Okay. As we were talking about tinted sunscreens, the BB creams also is like competing equally with the sunscreens. So how do people use this BB cream and treat it as like a sunscreen? Will that be working in same way?
See, there are a lot of products these days telling it is sun protective. Moisturizers telling combination with sunscreens. So these combinations, while choosing combination products, it's a little tricky. Always choose a sunscreen with moisturizer. Don't choose a moisturizer with sunscreen because the effect of sunscreen is lesser. The sun protection factor is maybe SPF 15. Your foundations, lot of your foundations are coming with a combination of sun protective factors, your primers. So all that will have a lesser sun protection factor. Maybe if it's going to be at least 30, you can combine your 30 SPF primer with the 30 SPF foundation and then dab it on with the powder. Then you've got yourself, a little better sun protection. So the way you lay up your products is also one. For example, you just have SPF 30. You need at least SPF 50. What you do is you can do a double application. So apply one layer of your SPF 15. Give it 2 minutes. Then reapply again and dab yourself with a compact puff. You have a little more than your SPF, maybe SPF 45, nearly about that. So these are your tricks, how you can get your makeup, like you said, your CC cream, BB cream to add a little more to your benefit with the sun protection.
Okay. At what SPF we should start this sunscreen usage? Because many people are using below 30 and they're saying it's doing its job very well enough.
Why people tend to be more towards SPF 15 is it's very elegant, cosmetically elegant, doesn't have white cast. Absolutely not the right way to go about it. You need at least SPF 30 to 50 like we were talking about. And reapplication, a lot of people come and ask me, can we do the sticks? Can we do the sprays? So I generally don't really recommend the sticks or the sprays, but still is okay with sticks. But sticks completely move your makeup. It doesn't really, just stop there. So try and figure out your reapplication. Powders are still better. And when you talk about sprays are not safe when you do it on your face, your hands, your legs, you're out on the pool, all that. Your sprays for your body is still okay. But on the face, I still recommend you do just good old conventional cream or gel method is better. And always choose SPF 30 to 50.
Very nice. So, like as we were talking about makeup earlier, with makeup we shouldn't sleep at night. We should like wash it off very completely everything. Same goes for sunscreen also.
Yeah. See, there are a lot of trends happening in the internet. One trend I really like is the double cleansing.
Yeah.
Nothing more than double cleansing. Triple adala kadiyadu. The double cleansing works really well. So even if we were talking about tinted sunscreens, we're talking about having a talcum powder. There are so much that we are doing. So it is better. You can use a micellar water. So use a micellar water. Wipe away all the grime, your tinted sunscreen or plain sunscreen, and then just gently cleanse your face with a normal cleanser. Then always follow it up with the moisturizer.
Yeah.
So before you go to bed, there shouldn't be a trace of sunscreen or trace of makeup or anything on the face. Just moisturizer.
Yeah. Like we've talked so much about sunscreen, but actually, how do we apply it correctly?
Okay. See, there are few tricks. Okay, one works for one person, one works for the other. To start, before we start off with application, I always tell you that too in summer, stand under the fan or in a AC room or where you get a little air. Okay, we're all sweating, especially post bath. We're all sweating and applying. So when you layer, like we always start with moisturizer. So after the moisturizer follows the sunscreen. So before you apply your sunscreen, give it 2 minutes. Before you layer, always give that 2 minutes. So let the moisturizer completely absorb. Then, okay, you want there are so many ways to measure your sunscreen. One is your 2-finger method. One is your dime size or the coin size method. Or one is your 2.5 ml. That's your half teaspoon method. So whatever that is, take that amount of sunscreen. Take half that amount first. Apply a first layer, so that you don't have that white cast or you're not struggling to completely apply it. Imagine doing full 2.5 ml or just splitting it into half. So the half is much more easier to apply. So give it another 2 minutes and then apply the rest. So you get double layer, you get more protection with the same sunscreen. So this is what I always follow. And then I always follow it up with a little bit of a powder. You can't step out without a little bit of your compact. It's completely safe. So it sets your powder and your product very well so that there is no washing off or, running away. It is more very, very elegant. Through the day, I'm done, I'm sorted. So this is how you apply your sunscreen.
Very nice. And talking about sunscreen again, does it really remove tanning?
See, sunscreen, like the name says, it's a photoprotective agent.
Yeah.
So tan is something that has occurred because of exposure. Once the tan has come, the sunscreen will not make the tan go away, but it will make sure that you're not tanning more. That is what is the sunscreen's job. So to remove tan, immediately, I've seen a lot of patients. Today they go out on a beach holiday. The next day they'll be scrubbing. They'll be scrubbing with scrubs, coffee, whatever. Never ever do that. Let your skin calm down at least for next 2 to 3 days. Just moisturizers and sunscreen will do the trick. Later, then you can get back into your exfoliation methods. You can use a good peel or a little milder peels like lactic acid. All that is a very safer way. Or in-house peels that you use on a daily basis. So you could do that. That helps you remove the tan. So that's better than depending on scrubs.
Okay. There are like so many myths about sunscreen. So let me start off with first one. It blocks vitamin D absorption. Is that really true?
See, that's actually one of the common myths, and a lot of patients refuse to take sunscreen. And naturally, we're all vitamin D deficient. So all our reports are proving so also. See, sunlight is one of the component that helps in the synthesis of vitamin D. But this sunlight has to be before 7 o'clock. During summers, it has to be before 6:30 at least. So, because the same sunlight or the same spectrum of light causes a lot of burning, tanning, cellular damage. So, we don't want that for our skin. So, get that little shot of vitamin D before 7 o'clock, I would say. So, even when you're applying your sunscreen, you could do that walk in the morning and get your sunscreen. I recommend a sunscreen even during your walks. See, what happens is when we were talking about sun protection factor, when I say 94 or 96, we still have that spectrum for us to absorb sunlight. It's only not on the face. There are so many ways sunlight can be absorbed and the vitamin D synthesis can be triggered. So nothing to do with your sunscreen or your vitamin D. Or even otherwise, if you're going to have a deficient levels, please take the supplement.
Yeah. Most of the people believe that tan is a sign of a healthy skin. Is it really true?
Maybe we'll reframe the statement a little bit.
Yeah.
A healthy skin, always a healthy body, healthy skin, always protects us, okay, in the form of tan. So anything to happening in our body, any stress, any damage, any injury, everything is, the first response of our body, especially our South Indian, South Asian body, is pigmentation. So that way, what happens is when there is a sun damage, the first way to prevent our skin from burning is a tan. So a good skin is doing its good job. But if you have to live with the tan and say it's healthy, not really. You don't want to be, darkened and feel that dullness. So you can, like we talked about exfoliation, those are good ways to remove tan and build up old cells. So you get your cell turnover active, you get fresher cells, so you're more glowing.
Very nice, actually. So another myth, I'll add a bit to it. So you need to wear sunscreen on only sunny days, not on rainy days or not on any other days, only on sunny days. Is it really true?
Not at all. I think one of the slogans all the dermatologists agree or will always be quoting is rain or shine, sunscreen is a must.
Very nice. Like simply said on like wonderful words. But most of the people are believing SPF 50. Below that, it is very worse not to use like that and all. There many people are believing. Is it really true?
I always prefer a SPF 50. Doesn't mean that SPF 30 doesn't do its job, but 30 to 50 is an appropriate sun protection factor. I wouldn't go below SPF 30 in our weather conditions and our setup.
Okay. And most of the people are believing that applying it only once for the start of the day would help it for 24 hours throughout the day. Will it be working like that?
Of course not. Definitely not. But there are a lot of practical difficulties in reapplying a sunscreen. See, when I am practicing or when I'm in a hospital setup, I can't really pull out the sunscreen and keep applying that 2 hours and do that. Of course not. But if I'm going to step out of my hospital building, or if I'm going to go from my building to my car or to the parking, even if it's a 10-minute stretch, I believe in reapplying, or I take my umbrella. So when it all depends on how you're going. If I'm going to be in the clinic from morning till evening, and if I'm not exposed to too much of light, then yes, once will do the job. But if you are going to be stepping out, yes, you have to reapply your sunscreen. I always, during your lunch, when you, have some time, when you finish your meal, when you're just, freshening yourself up, please reapply that sunscreen. That really works.
Okay. Are there any particular time frames that like within 4 hours or within 6 hours, 8 hours?
I say 2 to 3 hours usually. But that's when you're on a vacation, constantly out and everything. But when you're in office, till lunch, it can hold better.
Very nice. And another one. Sunscreen usually washes off with sweat and water. Is it really true like that happens?
If it's a bad sunscreen, it will. So, while going, most of the mothers during summer, they're very worried. If I can send especially in Chennai, we really don't have a lot of ozone-treated water pools. We have a lot of outdoor pools. So, very few indoor pools. So, in summer camps and everything, so they're very worried about the sun protection factor. Yes, you really need to see if your sunscreen is sweat and water resistant. Make sure that is written on the bottle, and SPF 50.
Okay, there's a viral video that a regularly applied sunscreen on face and without on neck. It tends to be having like more wrinkles on the neck, and the face is like so flawless and smooth. Is it meant only to be used on face, or it should be used on all the body parts, or like
entire body which is exposed?
Okay.
So even these days, these gel nail polishes are in trend.
Yeah.
So a lot of people will get their nails done. So one of the steps in doing your gel polish is getting it dried in a UV light. Even that time we tell the patients to apply sunscreen. You know, so any exposure and every exposure is damaging to the skin. So please, wherever your skin is being exposed in sun, apply sunscreen. Just that the face sunscreen might not be enough, or it just won't be suffice to use a small tube. Have a body sunscreen, have a face sunscreen.
Yeah. And most of the people have no idea about there are different types of sunscreen available for face and body. So like how can we differentiate like the essence and the amount of...
See, for the body and the face, the SPF doesn't change, but face is a little more gentler and a very soft and acne prone. So you need to be very, very cautious about the the formulation, the texture. So that is important. For the body, we could be a little liberal. So the volume of the sunscreen is a little more, so we can use it. It's economical.
Yeah.
So those are the factors.
Okay. So as a general tip to our viewers, can you say more about sunscreen and like usage of sunscreens?
Since we've talked enough about sunscreens, you know what you can do according to your, how it can be used as a makeup, how you can double protect yourself, all that, how to cleanse it off, how much to apply. I think we've covered most. So apart from sunscreen, how can you get your sun protection on point? One is your physical, wearing good UV protective clothes, that a good cotton, your scarves, your hats, all that can come into play during your summers. That is one extra way. If you're going on a hike, those UV jackets. So do that extra step. And one more thing is a very, very good diet with lot of antioxidants. So how do you get this antioxidant? Make sure there's a lot of color in your plate. Every meal, make sure about 2 servings of mixed colored vegetables. So it doesn't mean I'm going on a beach holiday tomorrow. Today I eat a bowl full of salad and I'm going to get that sun protection. No, it's like a cumulative effect. About 3-4 months, when you do this regularly, the sun protection naturally increases with your body. The self-repair, the amount of self-repair happens within the body increases tremendously. So that is one of the main things that you can add on to your sunscreen routine.
Okay. We talked about all the external applications of sunscreen, but internally as we speak, does really diet and stress management and exercise do reflect better like a glowing skin and everything?
Absolutely. I am a very avid believer of routine. So before I write my prescription, there's always one column where we talk about food, when you sleep, what time you wake up, if there is an exercise routine in your day, how much you smoke, how much you drink, how much desserts you eat, if the sugar that you're consuming is too much, you're eating a lot of processed food. So the lifestyle plays a huge role, not just in skin and having a glowing, the entire mechanism, entire organ has to function efficiently for you to get your hormones into control, for your acne not to come. So much happens within the body. So all that has to be under control only with a good lifestyle. So a lot of time people come and tell me I get my 8 hours of beauty sleep. It doesn't happen that way. It's about what time you sleep, because your hormones, your every melatonin, everything comes at a particular rhythm. So it is better we follow that. So 10 to 4 is what I tell. Even if you're watching a series, wake up at 4 a.m. and watch that series. So make sure there's about 40 minutes of exercise and a very balanced diet. And apart from that, a good minimal skincare routine is all you need.
Thank you so much, Dr. Sumit. It was like indeed a beautiful talk, and you're inside and out, like beautiful person to talk also.
I thoroughly enjoyed it as well.
Thank you so much. Amidst of your busy schedule, you took a great effort to explain us about sunscreen and all the lifestyle changes we didn't know that we need. Thank you so much.
Pleasure's all mine. Thank you.
Yeah. Okay. Viewers, thank you. For more skincare updates from a renowned dermatologist all over the country, stay tuned to our Skincare Must podcast. We are also available on YouTube, Spotify, Instagram, and for an Apple podcast. Thank you.